COVID-19 vaccination certificate is now a requirement to access government, ministerial and departmental offices. According to a presidential directive, similar measures will apply to visit all public and private offices. Where there is no up-to-date vaccination certificate, a negative PCR test within 24 hours is required. On Monday, some of the government entities started implementing these directives. At the Anti-Corruption Court, a number of people were denied access after failing to present COVID vaccination certificates.
I explained to them that I was vaccinated, but I don't have the card right now because the usual procedure, we present our national IDs.
Despite the presidential directive, the country is yet to register a rise in the number of infections. Between 27th November to December 3rd, 89 cases were registered, but the positivity rate remains very low at 0.8% out of the 11,634 samples tested. But after a review of the COVID-19 current situation globally, recommendations have been made aimed at avoiding a resurgence and flare-up of infections in the country.
But we have proxies that we use as case studies, especially in Africa, that is Kenya and South Africa. And when you look at the COVID data from Kenya and South Africa, the cases are beginning to shoot up.
Health experts concerned that the country's resources are constrained have recommended vaccination as a preventive measure against resurgence of cases. To date, at least 59% of the population, which is 18 years and above, has received 2 doses of the vaccine, below the recommended 75% by World Health Organization.
We are increasingly shifting away from the original Omicron variants that we had to mutated Omicron variants, which are very highly transmissible.
Currently, there are no active cases admitted in health facilities, and Uganda has not registered any COVID-19 death since October, according to the Ministry of Health.
Uganda's positivity rate is still low. It is varying between 1.2 to 1.5. However, that does not mean we are safe because we live in a global world. Soon, the positivity rate will go higher.
Uganda is planning to ensure 27 million people are vaccinated in the renewed strategy as a preventive measure against escalated COVID cases.
The vaccines are available at all our health facilities. And as per the presidential directive, those ones who are due for boosters, the vulnerable, those ones who took 1 dose and have not taken a 2nd dose, all those, including children between 13 and 12 and 17, need to ensure that they get vaccinated.
Kampala, Wakiso and Mukono are seen as the most prone areas to infection. Norbert Atkunda, NTV News.